Good afternoon, ladies and gentlemen. My name is Joe Underreiner. I'm the Kalispell Chamber President. We're pleased today to be able to bring you this program with our featured speaker, and honored to have Governor Steve Bullock to present his phased reopening of Montana, known as the Reopening the Big Sky Plan. Just a bit of housekeeping. You'll be able to ask questions via the written function in your menu bar. It's the Q&A section. So if you have questions, we'll do our best to get to as many questions as possible. On your toolbar, those are typed in. So go ahead and if you have questions as we go, feel free to have that put in there. And to introduce our special guest today, Governor Bullock, I would like to introduce Tom Ray with Weyerhaeuser. He serves as our chairman of the board for the Kalispell Chamber and also as chair of the Government Affairs Committee. And with that, I'd like to turn it over to Tom.
Governor Bullock, I'd like to extend a warm welcome from our 725 members here in the Flathead. We really appreciate the time today to be able to communicate and talk about COVID-19 and where we're at. We appreciate your leadership. I know you've had to make certainly some very tough choices over the last 6 weeks or so, but we're very interested again in talking about detailed plans moving forward. So with that, Governor, welcome, and I will yield the floor to you.
That sounds great. Thanks, Tom. Thanks, Joe. Thank all of you for allowing me to join you this afternoon. Look, and Tom alluded to that, over the last several weeks, Montanans, we faced unprecedented challenges. Our way of life has changed rapidly. Like every state in the country, our once thriving economy is ailing. We've lost family members and friends. I've said it before, and you'll certainly hear me say it again, that in times of crisis, I think Montanans really do pull together. This time's been no different. It was back in March, we knew that if we didn't act, there'd be dire consequences. So on Thursday, March 12th, we actually declared a state of emergency before there were any confirmed cases of COVID-19 here in Montana. Just a couple of days later, after the first confirmed cases of the virus in our state, we made the decision to temporarily close our schools and allow remote learning. On March 20th, we announced the closure of higher risk businesses such as bars, restaurants, gyms, movie theaters. And on March 27th, which for many of us certainly seems like a lifetime ago, Montana entered into the stay-at-home order. 4 over about half the states in our country did so. And we have been aggressively managing this virus. As a result of the actions that we've taken, and when I say we, that's not just me, that's Montanans in every corner of our state. We have among the lowest number of COVID-19 cases in the nation. And indeed, of all states now, the lowest percentage of positive cases when compared to our population, and also the lowest number of hospitalizations per capita in the country. In short, what we did is we flattened the curve, and we've saved both hospital resources and lives. Last week, I had announced that collective actions and sacrifices of Montanans have allowed us to get to where we are now. And that's really entering into the first phase of reopening our state. And we are truly one of by almost any data measure that you look at, one of the very few states in the country that can really even be having this conversation right now. And I think there's reason for great optimism, certainly, and yet recognizing that we should be optimistic, but this isn't necessarily time for celebrating. Continuing to ask Montanans to go to great lengths to protect one another, because as we start to reopen, what we want to do, the virus is still around. What we want to do is be able to stay open. And our personal responsibility really to protect those around us, and particularly the most vulnerable, remains just as important today as it has at any time during this pandemic. The plan that we put together to reopen, it's posted online at covid19.mt.gov, includes steps we're taking to reopen businesses, including specific guidances for businesses and others to follow to keep Montanans safe and healthy. We entered that first phase of the plan beginning this past Sunday, lifting the stay-at-home directive. Places of worship can now become reopened with social distancing. Main Street and retail businesses started open yesterday, Monday. Gyms, pools, hot tubs remain closed, as do other places of assembly right now, including movie theaters, concert halls, bowling alleys. We also returned local control over school districts to make their own decisions starting May 7th. In doing that, we're still encouraging social distancing, not having groups of larger than 10 or more together, and instructing all vulnerable Montanans to continue to follow that stay-at-home directive. Strongly encourage business owners, if you haven't had that opportunity, to read the guidance posted on the website to make sure that you can comply with some of these new recommendations and requirements when it comes to lowering capacity and social distancing. I know our local public health departments have been working, as they have significantly for the last 45 days, but to try to work with business as far as how we do this in a safe and thoughtful manner. And at the end of the day, these directives are what they are, but we're continuing to rely on Montanans' vigilance, both in hand washing and sanitizing, staying at home if sick, calling a provider to get tested if experiencing any COVID-19 symptom, still watching the non-essential travel. And beyond that also, visits to our nursing homes continue to be suspended except for certain compassionate care situations. And that's our senior and assisted living facilities really are among the most vulnerable places for cluster outbreaks, and can only imagine how hard it is for sort of our legacy Montanans to be isolated as they have been. We're doing that to really try to prevent those cluster outbreaks and keep our most vulnerable safe. Even as we're undertaking this phased approach to reopening with the first steps underway, we're certainly not out of the woods yet with this virus. And we all have to recognize that the new normal is going to look a bit different, and it's not gone. So as we turn back to support sort of those Main Street businesses and get more families back to work during this time, as we should, we also have to be watching out for one another and protecting everyone around us. We're going to be monitoring cases closely and carefully. You know, I think one of the most questions is, all right, we're going. Now when can we go to phase 2? Now when can we go to phase 3? I think in part that depends on how we all act and how this virus is acting. So we have to see how this works in line with our continued efforts to slow the spread of the virus. So again, that can be found at covid19.mt.gov. Again, appreciate you having me and look forward to hearing from you, your questions and your concerns and everything else. So thanks so much, Joe and Tom.
Thank you, Governor. We have 2 email questions to start off with. And the first one is from Kiana Gardner. She's an Interlake reporter. And the question is, there's a lot of confusion regarding how travel activity can be tracked and enforced. How are you relying to make sure that people do quarantine that are coming back into the state?
Yeah, and so as we lift this up too, and Montanans have been real careful, I think, from the perspective of recognizing that we got to watch out for our community. There is a real concern about what can happen with everybody saying, oh, you have the lowest hospitalizations or the lowest per capita positive in the country. So what better place to go during a pandemic than Montana? And we love, look, Flathead's a tourist community. We love our out-of-state visitors, but we still want to try to take care of our communities and keep the spread down. So 14-day quarantine for visitors to Montana for non-work related purposes still remains in effect. And we're asking everyone, if they do come to Montana or return to Montana, to go through that mandatory 14-day quarantine period. The specific question of how do we enforce that? I think that there are a number of things. Still right now at our train stations and our airports, we have National Guard members, soldiers and airmen at those places, giving individuals information, temperature checking them. When we're seeing anything that spikes from a temperature perspective, then getting them immediately to a referral to a doctor. In many instances, that's just done from a telehealth perspective. On the highways into our state, we have reader boards still set up saying mandatory 14-day quarantine. And the greater question though, so how do we get everyone to follow this? It's not unlike as we had the stay-at-home order and others that we're asking individuals to do so. And that's always got to be the first line of people being responsible. Local public health and local law enforcement certainly does have authority where they can enforce things. But step one is certainly hoping that Montanans and visitors to Montana will take this seriously.
Thank you. The second question that was emailed in concerns going to phase 2, which you talked a little bit about. I'm going to put a little twist on that. You think about Flathead County here, we've had no new cases, luckily, for the last 14 days. When you think about moving to phase 2, will that be at a statewide level, or might some counties move before others?
No, yeah, and thanks for the question, Tom, because I think that that's important from the perspective of, yeah, and we have no reported 14, cases for 14 days. We're also going to be, and hopefully rolling up tomorrow or in the next day, ways where I'm really hoping to expand testing capacity just to make sure that we're really gathering both information on symptomatic and at times non-symptomatic folks as well. That I think that when we look at going to phase 2, that's why we haven't put a 2-week time period on it, because we also got to recognize in many respects that like the information that we're receiving today is often, it's anywhere from 6 to 14-day lag, meaning that the actions that happen in phase 1, we're not even going to know for 2 weeks because we won't have known if additional community spread has occurred. Now, I'll say that certainly won't, there's a possibility when we look from going to phase 1 to phase 2, like it shouldn't just be, sheer number of cases that are increased. And I think we will see additional cases as, we sort of change our behavior, not stay at home. Like you could end up with one spike in one community or county. That shouldn't define the actions of every other state or every other community and county in our state. But whether we turn around and say, all right, phase 2 is now all up to the locals, haven't reached that bridge, we certainly want to make sure that phase 2 isn't defined, but what might be 1 or 2 hot spots in our state.
Thank you. The next question is from Andrea Goff and concerns Glacier Park and what you might know about plans to reopen the park. It's such a driver for the economy here in the summers, as you know.
Yeah, and it is. And I've talked to both Superintendent Mao up at Glacier, as well as Cam Scholey, the superintendent of Yellowstone. And I don't think they've set any sort of parameters on when they're opening yet. They've spoken of phased reopenings. There's been at least some discussion that possibility where they wouldn't have the capacity in the park to have people spending the night. So they'd say, well, they should all go to the gateway communities. Again, that sort of ties back to when we're going to start really opening up for out-of-state travel as well, because we want to do it in a way where both the parks have the capacity, but our gateway communities do, in as much as what we're having is if we end up with a bunch of folks coming to our state that could well be COVID-19 carriers, You know, we don't want to make the parks sort of infrastructure problems become our problems. So I've had the last, I guess, exchange that I had with Jeff, the superintendent of Glacier, was late last week, and we continue to have the discussion that we want to work together to make sure that we do this right, not just for the parks, but indeed for our entire state.
Thank you. We appreciate your thoughts there because, again, it's a very important asset to us here.
You bet.
Heather has a question regarding guidance for coffee shops, walk-up counter service. Any thoughts there?
Well, a couple different things. One of which, for sit-down coffee shops, sort of the same as every restaurant, of not groups of 6 or more, social distancing, still at 50% of what your code is, sort of what your occupancy rate is. And I think it is, and we're still encouraging people to wear masks when you're out in a higher density place like a grocery store or places where a whole bunch of folks can gather. And, you know, that's as much for everyone else. The cloth mask is really to protect everyone else from you, just in case you're a carrier. It's not like it's protecting everybody collectively. And I think that where social distancing is possible, do it. I'd probably encourage for a walk-up coffee place that, well, first I'd encourage, talk to your local health department, because they really are on the front lines. They can help you out with some of the spacing and things that you ought to do, and discourage what can be the prolonged interactions with the customers while you're still serving.
Thank you. The next question is from Melissa Cordova. She is the art director for the Hockaday Museum here in Kalispell. And she's got some concerns about where the museums fit in the reopening. You know, how are they different from Main Street retail? How are they different from a tattoo or a salon? So give us your thoughts on that.
Yeah, and that's one of the things that we're looking at even now, Alyssa, from the perspective of places of assembly, where a good handful of people can all end up next to one another, and a mixture of people. There's great concern about, because that's how community spread can exist. And art gallery, where if you could actually put in, or an art museum where you put in the sufficient social distancing along the way, even among the patrons, certainly is a little bit different than Exploration Works, which is a museum here in Helena. It's a kids museum where, you know, everybody's climbing and touching, things like that. So I recognize that it may not seem fair all the time as we look at places of assembly, but certain museums and the arts are one thing that we're looking at even within this phased approach.
Great. The next question is from Robin Bailey, and it concerns county health department and where they fit with the state plan. And I personally have had a lot of questions for people on the street, just going, okay, how's that interact between the state, county health officer, and Governor Bullock and his directives? So take us through how the state and the county work in the precedents there.
Sure, and can take you all the way through, right? That the state and the local health departments are in fairly, well, daily contact. I mean, even as before we put out this plan, had a discussion with some of the local public health officers. The way that the statewide directives are written, and that was the same with closure, is that local public health departments can be more restrictive than the state directives. They can't necessarily be, at this point, less restrictive, however. When it comes to, let's say that you have a COVID-19 positive case, it's by and large, then we end up at the state level talking to the local public health. They're the ones that are doing the contact tracing, trying to figure out where all that individual might have been, and then reaching out over the past 2 weeks, looking backwards to say, are there other people that ought to be quarantined? Do we need to be testing others? So their role is so critical all through it. It's that much more critical even now as well, because they will be the front lines of anytime we have a positive case, trying to make sure that we keep that positive case confined to just that one individual and not spreading. So we're working with them, and they're also both, I guess, if you will, the frontline responsibility for if a business has a question of what do these orders mean, or how do I best put this order into place. It's your local public health folks that can give the direct on the ground guidance.
Thank you. Got a couple of questions regarding people coming to work here this summer. I'll kind of put them together. One concerns people traveling from out of state for non-work purposes, but how about people traveling to Montana to work in the hospitality industry, as we frequently see summer, seasonals coming in. And the other question was along the same lines as I run a camp and wondering about my staff coming in from the country. Will they need to adhere to that 14-day quarantine period?
Yeah, so that the way that these are written, and it is because it's trying to capture as much people and minimize as many people as possible, is that if you're traveling to Montana for work-related purposes, you do not have to quarantine, because we can't just shut down all commerce. Now, if I ran a camp, though, just as an example, I would try to take every protected member or every protected measure for my staff coming in, because the other thing is we open up, the last thing that a camp wants or anyone else is that it was your business where sort of an outbreak began. So there's obligations on employers as they deal with both their employees and their customers in this plan, and encouraged to do everything you can when you're bringing in folks to bringing in employees from other states to make sure that you're not that business that actually takes Montana on a different path. But there's nothing directly prohibiting or requiring someone from out of state, if they're coming to work, to quarantine for 2 weeks.
Well, thank you for clearing that up. I was somewhat confused myself, so that really helps.
You bet.
We don't have any other new questions here, but I've got one. How are the state finances holding up right now? What do you think overall? Just what do you see statewide with your budget?
Yeah, well, so in many respects, like, not that anybody anticipates a global pandemic, but we walked out of last legislative session keeping $300 million in the bank above where sort of our budget was. We've put together, and the state never had this budget stabilization reserve where there's another $100 million in. It used to be, before 7 years ago, you'd walk into your next legislative session and say, all right, we've got to pay for the fires from the last year, and that became the first thing a legislature would have to deal with. We now have a fully funded fire fund to the tune of about $70 million. So we're ready for this fire season, and it wouldn't hit the overall budgetary sort of either the reserves or stability along the way. But just like every local government, every business is struggling. Look, revenues are going to be down. Activity is down. And I estimate right now, Montana is in so much better place to weather this storm, depending on how long this storm lasts, than other states do. But as we project, and we're looking at it regularly, where we'll end up, it's good that we have the $300 million cushion, but a $300 million cushion may not well be enough when you look at the overall sustaining of services Montanans expect from government. Now, I will say that, and at least once a week, I'm on calls with the federal coronavirus task force, which is led by Vice President Pence. President Trump's often on it as well. And I've heard both it's states that are led by Republicans and Democrats that are saying, as you look at what more the federal government's going to do, state governments actually have to balance their budget. So recognizing that to have a thriving federal and a thriving country, that the states have to provide the services that they are expected to. So I think that there will be continued discussion at the federal level of what more they might do with states.
Thank you. We had two more questions come in. Pamela writes, we run an outdoor wedding venue. What do you suggest to keep guests safe on the wedding day?
Yeah, I'd say a couple things, Pamela. And again, first reach out to, local health departments. But like if I look at the frame of what we've put out to date, and what we put out to date is like if a group of folks want to get together, it shouldn't be larger than 10 people where social distancing isn't practical. So, or if you look at our guidance for places of worship, it's, yes, an immediate family member can stay, family unit can stay together, but there should be social distancing of at least 6 feet between each of those groups of families. So I guess I'd encourage the same for an outdoor wedding, is that recognize that you still want to be able to have that social distancing. So among families and among groups. Now, phase 2, as we get there, we take it up from a group of 10 people that might be together to a group of 50. I recognize that will make it a bit easier, but that also then depends on how we get there, and when we get there depends on how much community spread we're seeing as a result of phase 1.
Our next question is from Diane Medler, who is on our chamber staff here. She asks, what is the timeline to receive information on the decisions made by the governor's Coronavirus Relief Fund Advisory Council?
So I think, and to step back from that as well, as far as what that is that, so each state is being given $1.25 billion on a minimum. And the way that that law was written was to pay for state and local governments' expenses beyond, directly related to COVID-19, not necessarily backfilling for past revenue losses or things like that, but expenses directly as related to COVID-19. And it hamstrings in as much as that it can't deal with your local government's issues of either declining or inability to get property taxes, other things. It would just be expenses directly related to. So I put together a group from the business world, from the nonprofits, others, to try to provide us additional thoughts of how that money could be best used, not only to meet some of the immediate needs of communities and businesses, but not to be replacing what's being done at the federal level, but the lifeline for some of the immediate needs, but also in a way that will sustain going forward, meaning that we want to get this economy ramping up as much as we can, so it'll be something that helps build the foundation for that. We finally received the first bit of guidance from the federal government as far as how we could use this money last Friday. And even that is woefully short, meaning can it be a loan program? Can it be grant programs, things like that? I expect that task force to give some recommendations at the end of, I think it's this Friday, this week is when they're charged to do that. And then we'll look at both what can be implemented along the way, knowing also that, this is going to be a sprint or a marathon, not a sprint. So we want to do things that are non-duplicative of existing programs, can get some of that money on the ground, but recognizing that this is a 7-month time frame throughout this year of the best way to use that.
Thank you. Joe has the next question on air service. I'll step out.
Governor, I think a lot of the questions this week, as we're moving from sort of, the shutdown or stay-at-home directive into more of an opening, right, is that there's just this disruption of, supply chain, restaurants, being able to get their supplies, even ramp up in terms of employees, the airport, right? I mean, that, that's not going to be just sort of turned on overnight. So it's this issue of, what kind of notice or how soon of a notice could we get It's somewhat of an issue going from 1 to 2, but it's really a big issue going from 2 to 3 when we can really fully get open and expect, and includes retailers getting stocked and supplied and knowing when that date is coming. Can you talk about your sort of thinking, you know, on the timing and the kind of notice you might be able to provide to businesses here in the Flathead and around the state, and being able to get geared up, right, just and with all the supply chain disruption that's occurred?
Yeah, thanks for the question, Joe. And I mean, that was even one of the things from the perspective of, it was even some local businesses when we were looking at when to open up restaurants that were saying that first we've got to make sure that we can comply with this, meaning that we need our safety, we need to put in the protective measures so we can stay open. But then even it would take longer to get both their employees back and some of those supply chains. Those are all reasons why we push those back until next Monday. I wish I could give a date or even advance notice to get from phase 1 to phase 2. But we won't know anything meaningful from phase 1, for an example, for at least 2 to 3 weeks. Meaning that you'll all see on your main street how people are complying, but in part, what actually guides this and what largely guides this is what's happening in the public health side. If you see a spike from downtown Kalispell, then that's going to make going to phase 2 that much more difficult. So we'll try to give as much advance notice as we can. I mean, I signaled not just last week, but even the week before, that we are going to start taking some steps on May 24th. But if we could predict exactly what a virus would do, this would be easy. That doesn't seem to want to follow, you know, any sort of calendars, if you will. So I recognize that's not the answer that any of us want necessarily, but I'm not sure what else we can do till we see what the impacts of a reopening are, which started effectively yesterday.
Yeah. Okay, thank you for that answer.
Governor, I don't see any more questions coming up here. Would you like to? There is no. Oh, there is. We've got operator error here. Okay. So let's see. Question from Heather on the restaurants. Restaurants need thermometers, masks, and sanitizers to open safely. Those items are scarce. What can the state offer? Is there any help there?
Yeah, and it's one where I recognize the supply challenges. I mean, we're even having discussions of how could we order en masse, you know, a whole big bunch of thermometers and start getting them out. But there are supply constraints along the way. So it's not that the state, and one thing that I guess I would encourage for businesses is that, you know, when we're talking about masks, and like we're not talking about N95s, the ones that your nurses and doctors are using in healthcare facilities. And that's something that there's literally not been a day that's gone by in the last 45 days where I haven't been also trying to be a supply clerk, like figure out ways that we can get, that's everything from testing material to masks. So we're trying to work on ways that we might be able to facilitate either through finances to local health or a larger group purchasing. But I think that's going to be one of the constraints that as an individual business owner, you should be giving consideration to. If you do want to get open, can you get what you need along the way?
Thank you. Got a question here regarding the possibility of a meat shortage. It's not just meat, but last couple of days in news we've seen chicken, pork plants, beef plants, processing starting to shut down. What do you know about that? How real is the possibility of shortages there when we think about that?
Yeah, and to tell you the truth, Tom, and the question, I don't know yet. I mean, like, look, we, I don't know, maybe last Friday, like wrote a letter to the Secretary of Agriculture to say, let's actually look at ways that we could get more local meat processing done still safely. to help meet some of those supply chains. Let's figure out how the USDA inspections are going so we can take care of that. And that would also help Montana producers as well. But I don't have a firm sense of, you have seen in a few of the larger slaughterhouses, huge clusters and contamination of COVID-19, but I don't have a firm sense yet of sort of the supply chain challenges along the way there.
Okay.
If I get anything in the upcoming week too, I'll get it to Joe, and then Joe can get it out to the members.
Yeah, that'd be great. We're still grappling with the paper shortage up here. So, we're already looking forward now to the meat shortage. Kim Cole's asked a question. She's driving to California this weekend. Will I be stopped at the border coming in or out? What are we doing there?
I sure hope so, Kim. Just kidding. There's nobody stopping people at borders. But the directive suggests, and the directive actually provides, that if you come back into Montana, that you should quarantine for 2 weeks. And that's for not just your safety, but the safety of the community around you, that we can do the best that we can with trying to protect one another. But as we are literally the lowest hospitalizations and per capita positives in the country, we want to do everything that we can to keep it that way. So there's no one at the borders stopping people. I mean, it was amazing 2 weeks into this, how many calls that I got from all over the state saying, you just have to have the National Guard shut down all of the borders, meaning all of our highways into our state, which didn't seem like probably the most practical or sensible thing to do. But the ask is that if you're gone to another state, if you're in situations, especially where we're not being protective, or that you could have a higher chance of being exposed, that you should take care of yourself afterwards when you come home.
Thank you. I think we'll do one last question, then to give you a couple of minutes to wrap up and summarize, Governor. So last question is, elective medical procedures, how's the state interactive in that? Is there guidance from the state coming around that? We're hearing the hospitals are thinking about wrapping up, but did you put restrictions around that, or was that self-imposed by the hospitals?
So we've also been in, to say regular conversation with hospitals and the healthcare providers would be a gross understatement. I mean, I don't think that there's been a week that I haven't had a call with the chief medical officers and the directors of the hospitals, regular contact with Montana Health or the Montana Hospital Association. Have had the same discussions with the community health centers as well. And their closure of elective surgeries was done by the medical community. It wasn't anything that we put out. And as they're going to be reopening elective procedures, that it's the hospitals that are doing that as well. And I think it's meaning the hospital community. They're all working on what the best practices are, how to keep both the patients and the providers safe. But it was nothing that was defined by a state directive.
Okay, thank you. I did hear that California Regional started doing cataract surgeries today, so taking a step forward. So that was good.
Yeah, and I think we'll see more of that. I mean, one of the things, and it's also been, and I so applaud the local healthcare providers in the hospitals. I mean, like, we have a direct sort of bird's eye into how many PPE masks and how many surgical masks individual hospitals and DESs and first responders have. And that way, when we get supplies, we can push them out along the way and try to get them. But I think one of the concerns, even though that really hit our hospitals hard in closing the electives, was just ensuring that our hospitals and healthcare providers had enough of a supply of personal protective equipment if they ended up having a surge of COVID-19 positives in their community and in their healthcare facility. So I know that the hospitals are still looking at that as well. How do we make sure that we have those supplies along the way? And then, just like we're trying to reopen from my statewide directives in a way that makes sense can get our economy going, but is still sufficiently protective so we don't get set back, I think that hospitals are doing the same.
Great, thank you. Would you like to give us a couple of closing remarks here?
Yeah, I'll just close, I guess, in part where I began with gratitude. Like, look, this is nothing that any of us have wanted to deal with for the last 45 days. And hopefully it's something that none of us will ever have to deal with again in our lifetime. You know, as a parent, just talking to my kids about them trying to understand what this is and what a normal will look like. But the gratitude is that how we got to this place where we can actually have this discussion about reopening is because of what people did in every community across the state. You can look at, it's not just an urban-rural thing. I mean, you can look at our neighbors to the east, and we took different actions in other states trying to be more protective up front, which is what got us to the point where we can actually be one of the small handful of states that, based on science, can say we can start opening up our communities and our economy again. So the gratitude is thank you to business people that are suffering, communities that are suffering, individuals socially, psychologically, and otherwise that took this seriously and said the way that we make sure that we curb the amount of hospitalizations, curb the amount of deaths, is to follow these practices. As we go forward, I ask you to have that same vigilance. I ask you to still take this seriously because the virus hasn't got away. And not just in Montana, around like the country, around the world, they're still learning things about this. Like the only way for sure that we know that we will be back to a complete normalcy is probably a vaccine. And that's a long way away. So the actions that we all take collectively in these upcoming weeks and potentially months, those are what's going to define what our state's looking like all throughout this year. So encourage you all to continue to take this very, very seriously and continue to, as we reopen our economy, if you're a business person, take this guidance and direction to heart, because we need to be protecting both your employees and your customers along the way. Every step that we take forward, we just want to make sure that they are steps forward and they're not steps going backwards. So really appreciate Tom, you and Joe and all the members of Kalispell Chamber having me on today.
Well, Governor Bullock, again, we thank you for your time. We know you're very busy. We appreciate your leadership at the state level, and we look forward to moving forward from here. Joe?
Okay. And Governor, speaking of gratitude, our thanks also to you for your leadership during this difficult time. We're all looking forward to getting things back to normal. Thanks for making time for us today up here in the Flathead. Appreciate your leadership and support of the work we do up here.
Right. Thanks so much, Joe. Thanks all.
All right. Thank you.
Take care.
Bye-bye.